Okay, good afternoon. Welcome to the National CARES Training Conference. This presentation will focus on monitoring, specifically monitoring of the HOPWA CARES Act, otherwise known as HOPWA-CV funding. My name is Ashley Kerr, and I'm joined today by my colleague Liz Stewart. We work with the Technical Assistance Collaborative and are a national HOPWA technical assistance provider. We have the pleasure of co-presenting today with two members of the Office of HIV/AIDS Housing, Amy Palalonis, the Deputy Director, and Jeff Keeman, who is a Management Analyst. We'll go into a few slides related to the presentation and housekeeping. All right, PowerPoint presentations and the webinar recording will be available on the HUD Exchange. Y'all will be in listen-only mode throughout today's presentation. If you need to use closed captions or would just like to use closed captions, they can be viewed using the Show Captions feature, which is right below the video player. And if you have more questions, feel free to consult the attendee guide for more information, and that's available on the resources page of the event website. If you will, submit content-related questions using the Q&A feature. You are encouraged to submit questions throughout the presentation. We will do our best to answer all questions that come in. If we cannot get to the questions or your questions by the end of our presentation, we encourage you to submit that question to the HOPWA Ask a Question or the HOPWA AAQ. If you don't know how to access the AAQ, simply go to the HUD Exchange, which is www.hudexchange.info, and type Ask a Question in the search bar. This will take you to the page where you can enter your information and go to and answer your question or ask your question. If you have technical issues throughout the presentation, please request assistance in the chat box, which is on the right side of your screen. And you can also email those questions to eventsupport@cdmgroup.com. And lastly, if you want to access the questions while simultaneously viewing this event, you can download the Slido app on your phone or go to sli.do into your web browser and then type in the code for this session. And I believe the support team is going to post the Slido code in the session in the chat. You can also scroll to the bottom of the page to find the Slido code in the session description. Okay, so today we're going to talk about monitoring. Specifically, how to prepare for a monitoring event and the various HOPWA-CV flexibilities and waivers that have been available during the pandemic. So let's jump into the overview of the monitoring process. Let's talk about the who, what, how, and where of monitoring. Monitoring events are handled by the field offices. And each year, a certain number of grantees are selected for monitoring. These grantees are selected for monitoring based upon a risk assessment the field office conducts. This risk assessment is based upon factors set by the program office, and can include a number of different items, including those listed on the slide. Grantees will receive correspondence, usually in the form of a letter sent or emailed from the field office stating that they have been selected to be monitored. This letter will provide additional details such as the type of monitoring, what will be monitored, what to prepare for the monitoring, when it will occur, dates for the entrance and exit conferences, and whether it will be on-site or remote. On-site monitoring did not happen during the past year, but there is a chance that they will occur in 2022. In addition to the routine risk-based grant monitoring activities that we're discussing today, the HUD field office and headquarters carry out reviews on an ongoing basis, analyzing financial data and reports. For most grantees, this work is happening quietly in the background. Occasionally, the program office, field office, and other HUD divisions identify a specific problem area with a grantee that requires a more in-depth review or site visit. In other words, while you may get monitored once a year, the program office and the field office are reviewing programs continuously throughout the year. So let's get to the why. Why are we monitored? Well, for one, whenever an entity receives federal dollars, there are strings attached, and two of these strings include ensuring these funds are used for their intended purpose and that they are serving the intended population. Additionally, a monitoring visit allows the field office to review grantee performance and ensure compliance with the applicable laws and regulations. Although no one is particularly thrilled to get monitored, it is a requirement and provides an opportunity for internal performance checks in addition to the external one conducted by the field office. There are two types of monitoring, one that is limited in scope and one that is more comprehensive in nature. When we are referring to the exhibits here, we're referring to the documents from the CPD Monitoring Handbook. An exhibit is a document that the field office will use when it conducts the monitoring visit. It is made up of questions and regulatory references that offer the citation or rationale for why the question is being asked. A limited scope monitoring is when a single exhibit is selected to be completed, for instance, a financial review, when the field office only views a grantee's financial management practices and documentation. An in-depth monitoring is where multiple exhibits are completed, so a field office reviews both the programmatic and financial aspects of a grant. Here are a couple of definitions related to monitoring: a concern and a finding. A concern is where a deficiency is found in program performance, but it does not rise to the level of a finding and does not require any action by the grantee. The field office will likely provide a recommendation on how to address the concern. Grantees should note that a concern could turn into a finding in the future, so this is something to consider addressing. One example of a concern would be slow spend down of funds. If the grantee is drawing down quarterly, but still has a large amount of unspent funds remaining in the last quarter of the grant period, the field office may suggest creating an internal spend down timeline so the grantee does not run into a future problem with not spending all program dollars. I should note that while I use this example of slow spend down, HUD can issue a finding if funds are not drawn at least quarterly. A finding is when a deficiency is found in program performance and does require resolution. The field office will provide steps for resolution. An example of a finding would be if the grantee spent program funds on an ineligible activity. So this is what a monitoring exhibit looks like. Field office reps will use exhibits from the CPD Monitoring Handbook, as I noted before, and supplemental exhibits that will be developed by the HOPWA office for HOPWA-CV funds, and they will complete these using information provided by the grantee. This is simply what it shows. You should consider using these exhibits as a guide for when your organization prepares for the monitoring visit. Grantees should also use these exhibits as a guide for monitoring their project sponsors. At the end of the monitoring event, there is generally an exit interview where the field office provides information about what they found and what will be included in the final report. The field office will use the CPD handbook as its primary reference for the monitoring visit and cite it in any concerns or findings. We should note that the current handbook found online has not yet been updated with CARES Act information. However, each program office has developed exhibits based upon the CARES Act funding flexibilities. If there are concerns, the report will list each one separately and include a summary of the cause and suggested actions if there are any. If there are findings, the report will identify them separately and include the origin of the finding, whether it's statutory or regulatory, a summary of the basis for the finding, and the proposed or required corrective action steps and the dates in which those action steps have to be completed. The CPD Monitoring Handbook does include a reference to the sanctioning authority for each program. For the HOPWA program, this information can be found in 2 CFR Part 574. So let's talk about preparing for a monitoring event. We've included 5 steps here to help your agency prepare for a monitoring visit. Step 1, don't panic. It's going to be okay. Everyone gets monitored at some point if they receive federal funding. Step 2, the information you need regarding your monitoring visit is in the letter that you received from the field office. Read it carefully. Use the letter to help your agency draft a preparation timeline and block off the monitoring visiting dates on your agency calendar. You will need access to your team at any time during the monitoring, so folks need to be prepared to be available throughout that time. This likely includes both programmatic and financial team members. Step 3, the timeline you create should give your agency adequate time to prepare for the monitoring visit. This may include uploading documents if the monitoring visit is remote, or frankly, if the field office wants to review documents prior to actually being on site. Always give yourself as much time as possible to prepare and give yourself more time than you think you need. Steps 4 and 5. Find your most compliance-focused team member or a team member who is incredibly detail-oriented, but isn't very involved in the program. Have this individual or individuals conduct a mock monitoring. This will include financial documents as well as programmatic and client files. If your monitoring letter says that client files will be reviewed, make sure that you pull 10 random client files and go through each of them with a fine-tooth comb and use the CPD monitoring exhibit as your guide. This will help you prepare for the monitoring exhibit better than just about anything else, and will also highlight what your agency needs to improve. Although there is no step 6, if there was one, it would just say breathe. Consider this a chance to shore up your project and build internal capacity. Lastly, I would be remiss if I didn't mention COVID-19 protocols. Please follow COVID-19 protocols such as masking and social distancing when conducting the actual monitoring visit if it is on-site, and offer as much information prior to the site visit to reduce the amount of time that there will be possible interaction. I'm now going to turn the remainder of the webinar over to my colleague, Liz Stewart.
Thanks, Ashley. Appreciate it. So this next slide is really going to be outlining all of the guiding documents that you want to be looking at as you are preparing your HOPWA monitoring, as well as your day-to-day that all of the staff at both the grantee and the project sponsors should be familiarized with a lot of the resources that are noted here. So there's the CPD monitoring handbook for HOPWA, that's chapter 10. There's chapter 34 of 2 CFR part 200, that's the uniform administrative requirements and cost principles and audit requirements for federal awards. So all of those sort of financial requirements that you want to be mindful of. The HOPWA regulation at 24 CFR part 574. Notice CPD 2005, that's the HOPWA notice on implementing CARES Act funding. And then all of the different CPD memos that have come out over the last year and a half or so that outline flexibilities and waivers that have been established around the HOPWA program. So there was that first waiver memo that came out in March of 20, and then 2 additional subsequent memos in May of 2020, and most recently December of 2021. In addition, a really great resource to look at just general guidance on monitoring and some of the things to be mindful of as you are preparing for monitoring is the HOPWA Oversight Resource Guide. And it provides a lot of guidance on things that you want to be looking out for when you're thinking about the different costs that you've used over the previous year and how you might document those. Now that was created prior to the CARES Act and way pre-pandemic here, but again, it really does have a lot of useful information in it that I think will make you think of the types of documentation that you would need as you're preparing for a monitoring visit. All applicable memos and resources, these can all be found on the HOPWA guidance for COVID-19 page. Okay, so in response to COVID-19, the federal government provided a number of supports to prevent, prepare for, and respond to this global pandemic. For HOPWA grantees, this came in the financial form of supplemental HOPWA assistance provided through the CARES Act, as well as through HUD providing regulatory waivers and additional flexibilities in the administration of the program. This slide provides a list of the flexibilities that were offered through the CARES Act and outlined in the HOPWA notice. And each of the flexibilities noted here are allowable uses of CARES Act funding or through your FY20 funds if they were designated for that use in their annual action plan for a COVID-19 response. We'll go over those additional waivers, that were those mega waivers, in subsequent slides, but first just wanted to walk through some of the flexibilities that were included in the HOPWA CARES Act notice. These included specific elements related to administrative costs, STROMU limits, hotel, motel stays, specifics around HOPWA supportive services, in particular, costs around transportation, how to use costs to access essential services and supplies, food and nutrition, as well as educating on COVID-19 risk and infection control costs. As I just mentioned before, you were able to use all of these activities with your FY20 allocation, if you designated as such for COVID-19. And for the CARES Act funding, it's really important to be mindful that grantees were responsible for preventing any kind of duplication of benefits with that resource. And so ensuring that there's documentation there too, that when you provided assistance under the CARES Act funding, that there was no duplication of benefits. And there's a whole separate guide on that as well, that it's additionally on that HOPWA COVID-19 page. So as you're looking at the slide and the list of different activities I just went through, and you're thinking about monitoring, it's important to note that for any of these flexibilities and the associated costs around those, there must be corresponding documentation in the grantee and the project sponsor records. For example, if the grantee increased their admin to 6%, the field office will review that financial information to confirm this, and that these expenses were eligible administrative costs. And that goes the same for the project sponsors with the 10%. Similarly, with HOPWA supportive services, an agency will need to provide documentation that these new supportive services were offered to the client and have documentation that tracks such services. For example, if the agency used transportation funding to pay to fix a private vehicle, that's an allowable use of those funds under the CARES Act. The agency would want to have the appropriate documentation for that. So items like estimates and receipts for the repairs would be in the file. Now looking at the HOPWA program waivers, this slide provides a list of the flexibilities offered through the mega waivers. These waivers were made available to assist grantees in carrying out programs during the pandemic and included documentation, flexibility around income and HIV status, increases to rent standards, for property standards, delaying initial inspections, and also the ability to conduct remotely, use of alternative spaces for housing and shelter with the HOPWA space and security waiver, with STROMU limits, allowing up to 12 months of STROMU in a 12-month period on a case-by-case basis. And then also short-term supportive housing limits up to 120 days versus the 60 days in a 6-month period that are established in the HOPWA regulations. So again, similar to what I just mentioned on the previous slide with the CARES Act funding, if you use the HOPWA program waivers in your programs, including the waivers for your regular program, with each of these, there should be supported documentation, including notification to use the waivers to the CPD director, as well as any grantee or project sponsor policies that were developed around the use of waivers. You want to have that documentation available. And again, the documentation for each of these that shows that you met the standard. So for example, with STROMU limits, that you would show the documentation that you met the limitation of 12 months of assistance in a 12-month period. So this slide just outlines the different waivers that have occurred with the HOPWA waiver extension. So to date, HUD has issued 2 mega waivers and 3 waiver extensions containing provisions for the HOPWA program. So the first came out in March of 2020. That was the first mega waiver. The second mega waiver came out in May of 2020, and then there were subsequent extensions of those. So the first extension in March of 31st, second extension going to June 30th, and then or outlined in June 30th, and then the third extension just came out at the end of December 30th, 2021. So there have been a number of waivers that were extended through 2021 and now into 2022. And this chart provides a listing of the waivers and their end dates. And any waivers used need to correspond with the documentation in the agency's files that these waivers were not used the post end date. So if we're looking at the self-certification of income and credible info on HIV status, that was initially went through the mega waiver 1, and the end was when public health officials determined special measures not needed. And there was a waiver extension that ended at 9/30/2021. So you would need to make sure that that self-certification that ended as of September 30, 2021. The ones that are highlighted in red, those have now actually been extended through March 31st, 2022. So that applies to the FMR rent standards for HOPWA, the property standards for HOPWA, as well as the HOPWA space and security. So for those ones, you are able to still apply that waiver, assuming that you made the proper notification and can continue to do so through March 31st, 2022. Okay, and now just want to be looking at HOPWA and COVID-19 funding streams. So for formula HOPWA grantees, there are 3 potential HOPWA funding streams that may be used for COVID-19 activities, including CARES Act funding, and that's usually referred to as HOPWA-CV. You've got your FY20 funds. If you designated FY20 funds for use of COVID-19, and those were that was outlined in the annual action plan, that's an eligible source of HOPWA funding for COVID-19 activities. And then just your regular formal HOPWA awards can also be used for specific COVID-19 activities, including with the use of the waivers if you decided to use those. For competitive HOPWA grantees, there really is only one HOPWA funding stream designated for COVID-19 activities, and that is the CARES Act funding, those awards under the HOPWA-CV. Competitive grantees can continue to implement their current grants as approved and make use of all waivers. Formula grantees had to submit forms listed on this slide to receive their CARES Act grant allocation. The grantees' files must document when this information was submitted to HUD for review and keep a copy of the correspondence. Grantees should have these documents available if requested. So one question that you might want to be mindful of that might be asked, are the activities provided consistent with addressing the housing needs described in the HUD approved CARES Act substantial amendment? That might be something that comes up during the monitoring, and you want to be able to say, yes, that the documentation you have shows that the activities provided were consistent with addressing the housing needs described in the substantial amendment. For competitive grantees, they must also document where their information was submitted to HUD for review and keep a copy of the correspondence. Grantees should have these documents available if requested. And just note that there is a video recording titled Implementing the CARES Act for HOPWA Competitive Grantees that offers additional information about this topic. It's a YouTube video you can watch, and it's provided on the HOPWA-CV webpage. So you might want to take a look at that. And also just this slide is really outlining if you received the CARES Act allocation, the grantees must have submitted a brief description to HUD, and it included all of these different bullets. So the type and amount of each eligible activity the grantee anticipated undertaking, the process that took place to carry out the work quickly, how eligible households were able to access the assistance during the period of time. The grantee's main operations were closed due to local public health department directive. And if there are any changes to the original applications, these must have been documented as well. The grantee also should have included the following forms. So the HUD 40110B and SF424 and SF424D. So that's something to be mindful of if you are a competitive grantee. All grantees must document how HOPWA CARES Act funds are structured to address the impacts of COVID-19 in their IDS activity setup. Formula grantees must also include this information in their con plan. Additionally, OHH recommends that project sponsors include a general statement in each client file that indicates CARES Act funds and waivers were necessary to assist HOPWA eligible households with challenges caused by COVID-19 in their respective communities. And this bold note is really important here, since I think there has been some confusion about that recommendation. So you want to document the community need in the file and in the client file that's most helpful. But this does not mean that a client must document how COVID-19 has directly impacted their family to receive assistance, as such documentation is not required for families to access HOPWA-CV dollars. So just be mindful of that distinction as well. Okay, additional key points. The language in bold here is really important. First, grantees and project sponsors had to notify the HUD field office 2 days prior to using any waiver. So this needs to be documented in the agency's files. Any costs that were incurred related to CARES Act funding must be documented. So any receipts, any invoices, anything that's showing the documentation of the costs must be available if requested, and really show that those costs for use of the waiver flexibility, that none of those would have been incurred with that flexibility prior to that notification happening. Additionally, grantees must also notify the field office of their intent to utilize the waiver time extensions included in the memos. Okay, now this slide is a nice little chart that provides a sample of some of the client file documentation that you may have, depending on what waiver was decided to be used. So in this case, we have a file of a project sponsor where the grantee had ended up using 2 waivers, the self-certification of income and HIV status, as well as the property standards for HOPWA. So in this first, for the first one, the self-certification of income and HIV status, justification would have been that the agency was unable to verify the client job loss from third party because the store closed indefinitely due to COVID-19. And so that would be an example of what is kept on file for the self-cert. For the property standards for HOPWA, you would be able to go back and look at the policies that the grantee developed to show that they had set a policy to remotely inspect all units through December 31st, 21. Now, if with the waiver being extended around property standards, if now they plan to go ahead and update that policy to go through the end of March, again, we'd want to see that update to the policy there if there is a plan to continue to do remote inspections. So here's additional chart with the examples of acceptable documentation. In addition to a one-pager or checklist regarding the waivers, we referenced a few slides earlier, the client file should have documentation that aligns with the waiver. So if an agency uses self-certification waiver, then there needs to be documentation of this in the client file. Typically, a client file will have a pay stub or other third-party documentation, but with self-certification, an agency can write a document or have an electronic file stating that the client reported their income level. Regarding HIV status, the client file should have documentation that they reported taking HIV medications or have knowledge of their viral load or viral suppression. Additionally, the caseworker can note that the client is a patient of a doctor that is known to treat individuals with HIV, or if an HIV agency refers the client to the agency. In other words, some indication the client has HIV without having an actual diagnosis by the doctor. For waivers related to rent standards, again, just looking at some of the examples of acceptable documentation. For the FMR rent standard, if the grantee and project sponsor decided to go above the rent standard and ensure that it was rent reasonable, that documentation needs to be in the file, since that is a requirement of that waiver. There is a HOPWA rent reasonableness document that can be found on the HUD Exchange. I'm sure many of you are familiar with that already, but you want to make sure that that is in the file as well, because the unit cannot exceed that rent reasonableness standard. Again, this waiver can be used through March 31st, 2022. Just make sure that that notification was provided to the field office. For additional information on rent reasonableness, there is a going to be, for this part of this conference, there is a HOPWA property standards and rent standards waivers that will be held tomorrow. That's January 25th at 1:45 Eastern. And our colleague will be reviewing rent reasonableness during that training. So I think, for any of the items that we're talking about today, there could be a whole training on a lot of the different items that we're talking about, and that's monitoring such a big topic. So it's really just making sure that you have the documentation to meet the requirements. And so check out any of the additional sessions that are happening this week related to any of the topics that we're talking about here. Again, continuing on with the property standards, if an agency used the property standards waiver, there needs to be some record of a visual inspection, such as a video or a time, date, stamped photos, in addition to a written policy that the unit will be physically inspected when it is safe to resume these activities. The agency should also have written policies to physically re-inspect the unit after health officials determine special measures to prevent the spread of COVID-19 are no longer necessary, and these should be available for review during the monitoring visit if requested. Next up, examples of acceptable documentation related to HOPWA space and security. HOPWA space and security relates to habitability standards, specifically to the requirement that residents must be afforded adequate space and security for themselves and their belongings. And this waiver provision was developed to allow programs the flexibility to do such things as temporarily house a household in a space that would otherwise be considered too small, or having inadequate space, such as a hotel room, or housing multiple household members. It also allows the use of unconventional spaces, such as a dining room or other room within a facility as temporary housing, or a quarantine space where needed, or other temporary space situations that just may not meet the HOPWA space and security standards. So this waiver provision simply allows grantees and sponsors some flexibility in using space that is normally not considered adequate. And the waiver is very short term. It may be only used during the period of time where the quarantine measures are recommended by local healthcare professionals, and is specific to short-term housing situations made necessary by the COVID-19 pandemic. So the agency should have a written policy for alternate space and security requirements for quarantine purposes based upon the waiver information, and a written policy for hotel motel stays. Grantees could have receipts for hotel motel stays on hand for review as part of their financial documentation in the agency's accounting and finance departments. Okay, now looking at STROMU. So the STROMU waiver refers to the use of regular HOPWA allocation and the ability to provide 12 months of assistance during the program operating year. This is not a blanket decision for all households, but rather must be determined on an individual basis. To use the waiver, grantees and project sponsors must meet the following criteria. The grantee or project sponsor documents that a good faith effort has been made on an individual household basis to assist the household to achieve permanent housing within the time limits specified in the regulations, but that financial needs and or health and safety concerns have prevented the household from doing so. In addition to this, the grantee or project sponsor should have written policies and procedures outlining the efforts to regularly reassess the needs of assisted households, as well as processes for granting extensions based on the documented financial needs and or health and safety concerns. And again, the waiver end date on that is has passed. It was the end of December. So going forward, that would no longer be able to apply. But if you're looking back at all of the households that were able to use that waiver up to it, this is the documentation that you'd want to have in the file. And that just want to be note here that, in that column on the left, we're talking about the HOPWA waiver, which is different than what is allowable under the HOPWA CARES Act funding, or if you had those FY20 funds designated for COVID-19. In those situations, the time limit is longer, allowable up to 24 months. And that's what we're going to look at this next slide. So STROMU, funded by the CARES Act, and again, or the FY20 funds designated for COVID-19 response, are able to use STROMU for 24 months. And this represents an extended STROMU option made available through the CARES Act. Households receiving this category of STROMU can use up to 24 months of STROMU assistance. Acceptable documentation of the file would include case management notes that the agency has been trying to support the household to stabilize housing, that the case manager is following agency policies and procedures. So if whatever policies the grantee and the project sponsor have developed around the timing of reassessing household needs and what should be included as part of that reassessment, you'd want to have in the client files that was being followed. And again, this can be used until the HOPWA-CV funds expires or the grant period ends. So within that 3-year performance period. Okay, so we just went through a lot of information. Wondering if we've gotten any questions yet.
We've gotten a number of questions and we've been answering them in the chat, but it might be worth if Jeff and Amy might be willing to answer a couple of these live while we are feeding it to them.
Sure.
Okay. So one of the questions is, what happens if we as a grantee did not provide the field office the appropriate waiver 2 days prior to use? What if it was provided a few days after use?
So I was looking at that question, and we can't really answer that question today. That's definitely a good question and something that will inform our work and sort of finalizing the plan for monitoring and the exhibits. I mean, I can say that it is good that notification was provided within a few days of the waivers being utilized. So it's not like no notification happened at all, but I can't specifically answer today exactly what will happen if that comes up during monitoring.
Okay. Here is another question. Is rent reasonableness capped at 10% above fair market rate?
No, there is no cap on rent reasonableness. And it sounds like this is a good time to plug one of the webinars tomorrow, one of the sessions that will be specifically talking about rent reasonableness. And I am blanking on the name of that session. Does anyone else have that handy?
I will find it while
Okay.
while I'm feeding you the next question, which is
Sure.
also on rent reasonableness.
Okay.
Do you need to have rent reasonableness if you use FMR and are not above it?
Yes. So rent reasonableness is always a requirement of the HOPWA program. Whether it was the, pre-COVID, before we had these waivers in place that waived FMR, and now rent reasonableness is always a standard of the HOPWA program. And again, yeah, definitely check out the HOPWA property standards and rent standards webinar tomorrow. That will be going into this in more detail.
Okay, those are all of the questions that we had not answered yet. But maybe we go through some of the questions that were answered just in case people weren't able to access the Slido Q&A. Okay, and that gives folks another couple of minutes to post their questions in the chat. So one of the questions was that folks had trouble identifying which of the exhibits were related to the current seminar. So we posted a direct link to the CPD monitoring handbook that's in the chat up earlier. The HOPWA-CV exhibits have not yet been finalized. And so Jeff and Amy, are you going to be sending out an email once those are finalized to all the grantees and project sponsors?
Yes, so once those are finalized, there will definitely be communication and messaging around that. There are two different HOPWA listservs, and I'm sure it will be sent out on both. One is the HUD.gov HOPWA listserv, and whatever we send out through that is then also reshared through the HUD Exchange HOPWA listserv. And so if you are not signed up for both of those, I definitely suggest that you do so. And I can put links to those in the chat.
Okay, so then this next question I think is pretty obvious, but just so we can confirm it, have there been any CV monitorings yet?
No official monitorings of HOPWA Cares grants as of that will start this year. Yeah.
Okay.
The financial side may have happened if it last year if it was part of a regular monitoring, but no official HOPWA-CV monitorings for the whole programmatic side. That'll start this year.
Okay, great. Is HUD considering a coordinated entry requirement for HOPWA-funded project entry to assist with deduplication of benefits?
No, so thank you for that question, but no, not at this time. We are not considering that.
Okay. How will HUD verify if a grantee used a waiver past the expiration date by requesting documents that are a few months after the deadline ended?
Yes, so basically verifying that will be done through looking at mostly client files as well as other relevant documentation, but essentially a lot of the monitoring will be happening. Well, none of the monitoring will be happening until the CV exhibits are updated and finalized. And so we're expecting that to be in the spring or the summer. And at that time, the waivers will be expired for the most part, unless there happens to be extensions. But in this most recent waiver, we did say that that is extremely unlikely. So most likely by the time folks are monitored, most of the waivers will be expired, and we will be looking at client files, sort of detailing how detailing that that you notified the field office that you were utilizing the waivers, documenting client files that the waivers were utilized, and then looking at how the after the waivers were utilized, the information contained in the client files.
Thanks. All right, here's one on hotel motel stays. How long outside of COVID infection are the hotel stays still available?
So the general HOPWA guidance for hotel motel stays is no longer than 60 days in a 6-month period. That is guidance. It is not regulatory, but it really, that guidance is in place so folks aren't just living in hotels for an extended period of time, and that just ensuring that the focus is on getting people into permanent housing or more suitable living situations. So there can be, assistance or stays in hotels can be provided for longer than 60 days in a 6-month period. But, you know, generally the exceptions for that should be documented in the client files, and we detailed a whole lot more information on hotel motel stays in that resource that was provided in the answer to that question. I'm not sure, and it was provided in the chat as well. So I encourage you to look at, to check out that link for guidance around hotel motel stays.
Okay, 2 more right now. One is, should we be documenting rent payments in HMIS?
That is a question that I don't know the answer to. So.
Yeah, I think we should. I'm not 100% sure either. So
yeah, I would say that submit that question through the AAQ, and you can get a response that way.
Okay, can you please clarify the use of security deposits with CV funds?
So the guidance around security deposits hasn't changed. It's the same for regular HOPWA funds and for CV funds. So I think I would need a little bit more information about that.
Okay, so maybe that person can
Yeah.
ask that question again with maybe a little bit more detail. Okay, there is one more question. And you may or may not be willing to answer this, but the question is the final expiration likely across all CPD program waivers? I think many of us oversee multiple programs.
I can't speak for any other programs. I will say that when we, the most recent waiver memorandum that included HOPWA waivers also included ESG and COC and maybe some of the other homeless programs. And when that waiver was put out, there was language in that memorandum saying that extensions are unlikely. And that once these the waivers in this memorandum expire, waivers would then would most likely be moving on a case-by-case basis. So instead of a blanket waiver like we have been providing, it would be, if waivers are still needed, we'd be moving in the direction of grantees requesting those waivers from HUD and granting them on an individual basis based on individual community or program circumstances, instead of just providing the blanket waivers as we have been doing.
Okay, Liz, maybe you and I want to weigh in on this one. Does that spreadsheet of waivers used for each client need to be in the client file, or can we have a master sheet?
I'm going to go back to that slide.
Perfect. So I think one of the things that I would just point out is that the most important part here is just documentation, right? That if the field office is able or asks the question, they want to be able to see where you have documented the use of the waivers. So it makes sense if there's particular waivers that you used for that client to have that information in the client file. But what I will point out is we just gave this as an example. This isn't something that, to my knowledge, is going to be required from the Office of HIV/AIDS Housing. It's something that we just offered that grantees and project sponsors could use to make it easy, an easy reference point for the field office. Liz, what would you add to that?
Yeah, I mean, I would echo that. And I would say a lot of times it will depend on how you've structured your own file documentation system. So I know in some cases, grantees or project sponsors, really project sponsors, I think in this case, might have set up, for example, their property, they might have property files that are separate from the client files. And so there might be like the inspection report and the rent reasonableness, like that might all be located in some other file that is not the client file. So for that particular waiver, I could see why that would not necessarily be in the client file. But just keep in mind any of the eligible activities that are, part of the time limits and things like that related to STROMU or whatever else. Usually, typically, you would see that the timeline for something like that in the client file. So maybe having like a master list of all of the waivers that the grantee had, but in some situations, I think the documentation would make the most sense when you're getting down to timelines and things like that. It would be at the client level.
Amy and Jeff, would you add anything to our response?
No, I think that covers it.
Okay. There was another HMIS question, and I think I'm just going to take the liberty of suggesting that that person submit it to the HOPWA AAQ so that it can be answered appropriately.
Yes, definitely.
All right. I think we have come to the end of our questions. I don't know if you want to give everybody just another minute, and if Jeff and Amy, there's anything that you want to add prior to finishing this session.
I don't have anything to add. I just thank you all for participating in this session and asking your questions, and for all of your extremely hard work, over the last 2 years, almost, implementing the CARES Act funding as well as these waivers. And we really appreciate all that you do.
I second that.
And I'll just put a plug that to put any questions, submit any questions to the HOPWA AAQ. You get responses very quickly. They provide you with the statutory information and can answer any of your really tough policy questions or programmatic questions. Okay. Thank you so much for joining us. Again, this will be posted on the HUD Exchange when it is complete and this CARES Act conference is over. But again, reach out with any questions to the HOPWA AAQ, and thank you for joining us today.
Thanks, everyone.
Thank you.
Thanks.